Hello, my name is Nadia Ali, and I have been invited to talk to you today about mental well-being. The first thing that I want to do is to say thank you to Finn for inviting me to be part of this wonderful conference once again. When it comes to well-being, there is nothing that can replace knowing that you have a community of people who understand you. The picture here is from the Finn meeting in Barcelona in 2019. I really enjoyed that meeting. It was the first time I'd ever been to a Finn meeting, and it was a fantastic experience. I so miss being able to meet like that in person, but I'm very grateful for the chance to meet it all. I want to start by acknowledging and emphasizing that mental well-being is influenced by a lot of different components. Intellectually, if our brains don't have enough to keep us interested in life, or if there's way too much pressure on our brains and we can't keep up, that decreases our well-being. Environmentally, we need clean water to drink and a safe place to live. Financially, and in our jobs, occupationally, those are very important to our overall well-being. Spirituality can be, for many people, a source of well-being. Physical aspects, of course, are important to our well-being, and that's why we're all here today to talk about the physical aspects of living with Fabry disease. And I know that almost all of the other presenters are talking to you about that, so I will defer to them. Emotionally and social support are incredibly important aspects of mental well-being, and we're going to talk more about them in just a moment. But first, I want to talk about self-acceptance. One of the most important parts of mental well-being is to accept ourselves for who we are as we are. It is very common, not just for people living with Fabry disease, but for all of us, to be our own worst critic, which has a huge impact on our mental well-being and our overall well-being. And it's also important to remember that different people experience things in different ways. People can be exposed to the exact same event, but experience it differently. Mental health challenges are completely normal. And even those who seem on the outside to be doing okay are often not quite as put together on the inside as they might seem. In other words, especially when you're living with a chronic condition like Fabry, this picture might be accurate. You've actually got it backwards. I'm faking being well today. Next, I want to talk about self-expectation. Goes along with self-acceptance. So let's reset our self-expectations. Often the expectations we have of ourselves are unrealistic, but we set them for ourselves to meet some standard that we have in mind of what we ought to be able to be or do or accomplish. And then when we can't quite live up to that because life throws us a curveball, or this is a pain day, or anything else that gets in the way, we can feel inadequate. In doing so, we set ourselves up for a vicious cycle. So I have these expectations, I can't meet these expectations, so I feel worse about myself, which gets in the way of achieving the expectations, which just goes round and round. It is okay not to be perfect. It is okay to accept that reality rarely turns out the way we want it to. For example, I can't tell you how many times I have had to restart this video because something in my slide deck didn't work or aspects of the technology didn't work, but that's okay. I'm here. I'm really happy and grateful to be talking to you, and I will restart the video as many times as it takes. because that's what reality is like. I often tell my students and individuals I see clinically to take things moment by moment, particularly when things aren't going well or we're feeling overwhelmed or we are in pain. I suggest that individuals engage in a strategy called chunking. And that's focusing on whatever bite-sized piece of a challenge feels manageable to you. So if it's a task you need to accomplish, breaking it down into steps and going, all right, let's just deal with step number 1 first. That's really all I can handle right now. If it's more of a situation that feels unmanageable, breaking it, chunking it down into a week, a day, maybe an hour, maybe 5 minutes. I can get through the next 5 minutes. Okay, now I can get through the next 5 minutes. Just keep going one chunk at a time, whatever feels doable to you. And set a timestamp for how far ahead in the future you're going to let yourself worry about. Okay, if I've set an hour that I'm just going to get through the next hour, then I'm not going to worry about what happens beyond that. I'm just going to focus on getting through the next hour. If I've set a day, I'll focus on getting through that day. Take each chunk one at a time and move through stress in pieces, and find people who will support you in doing that rather than criticize you for any perceived things that you're not doing. And while we're on the subject of support, there are different kinds of support. And I want to talk about just a few of them here. So there's practical support. When you are finding your support people, practical support includes people who can help you with practical things, whether that's a ride to the doctor, help around the house, shopping for groceries, mowing the lawn, whatever that might be. And those people are often very different from the people who provide emotional support. They can be the same person, but often they're not. An emotional support looks like reassurance, trust. I can call you at 2 in the morning if I'm feeling anxious or depressed or worried and can't sleep. Those are the people who are there for us emotionally. And then appraisal support. So if I need help figuring out a situation and planning how I'm going to deal with it and how to cope with it, that may be a different person entirely. So my main message here is that it's okay if the people that you surround yourself with for support can't provide all different kinds of support in the same people. That is completely okay. Some people don't want to talk about feelings. Some people would much rather drive you someplace. Some people are really good at planning, but can't help around the house at that moment. The next thing I want to talk about then is prioritizing and delegating, learning to ask for help when we need it. It's not a sign of weakness. We can't do everything. And sometimes those support people are there to help us, but we have to let them help us. All of that having been said, there are times when we may feel anxious, whether we have Fabry disease or not. And we know that anxiety and depression in particular are something that living with Fabry disease can increase our risk for, whether that's organically or in reaction to living with a chronic disease. Either way. Keeping a sense of humor is important, especially on the bad days. Sometimes it's really hard to get through something, and laughing to keep from crying, that's okay. Letting the tears flow is also okay. Sometimes the only way to get through something is to acknowledge the absurdity of it. Celebrating milestones, birthdays, graduations, marriages, births, anything. Those are big things, but celebrating small things. I got through today and it was hard, but I did it. Giving yourself credit where credit is due, giving other people credit where credit is due, because they're probably struggling too. Not only focusing on the challenges, but celebrating where you can. Spending quality time with your loved ones, and there are many different forms of loved ones, including pets. Another thing I find really helpful for me personally is finding ways to help others. Doesn't have to be a huge way, can be a small way, but helping someone else or giving a compliment or positive feedback to someone else very often helps us as well, brings up our feeling of well-being. Maybe you cannot help someone in the way you want to at that moment, but you can help them in a different way, or dividing the tasks, organizing a group of people who can help others. It doesn't have to be anything big, but it gives us a sense of giving as well as taking. Now, I mentioned anxiety and depression before. If you are having difficulty, it is important to reach out for help. I talked about delegating, allowing other people to help us. But I also want to talk about professional help, mental well-being. There are mental health professionals who can help, even when we can't see them in person. More and more mental health professionals are using Zoom or other telehealth platforms than ever before. So investigating what might be available to you can be very important. Now, there are some techniques, if you don't have access to a mental health professional, that you can use on your own. One of them is called diaphragmatic breathing, also known as deep breathing. And that's the idea of fully filling your lungs with air so that you can get all the benefits of that oxygen to your brain and the rest of your body. It calms the stress level. It lowers your physiological response, helps with anxiety. Basically, it's inhaling through the nose, and you should be able to feel your belly moving out. When you do that, if you put your hand on your belly, you can feel it. Holding it for a count of 3, and then exhaling through the mouth, releasing that air. Doing that for a cycle of 10 at a time, or as many cycles as you need. Progressive muscle relaxation can also reduce anxiety, stress, muscle tension, can help with sleeping. And it helps us learn, it helps our muscles learn the difference between being tense and being relaxed. Sometimes we're tense and we don't even realize it. But using progressive muscle relaxation can help you learn how to relax your muscles consciously. Breathing in, tensing one muscle group, holding it, and then relaxing, then going on to the next muscle group. So you might start with your feet, work your way up to your lower legs, your upper legs, your stomach and trunk area, arms, your face, everything, just to doing one muscle group at a time. And there are people who can help you learn to do this, going much more slowly than I'm going now. Guided imagery can also be incredibly important. 10 minutes of guided imagery can promote relaxation, which can lower blood pressure, lower cholesterol, glucose levels in your blood, and heighten short-term immune cell activity, reduces stress and anxiety, can lessen headaches, help you cope with pain. Here's another slide for guided imagery. This is also a technique that a professional can help you learn to do, but you can then do it on your own. So diaphragmatic breathing, progressive muscle relaxation, and guided imagery are all techniques that you can learn how to do in your own private space in your home without needing a professional there after you've learned how to do them. Now, I want to thank you very much, and I will be available live in just a few moments for any questions that you might have.